Children at school face several challenges in making sure that the asthma stays under well control, as compared to being at home where family and children can kind of minimize their exposures and triggers that may flare up their asthma. Children at school are often exposed to respiratory viruses, allergens, exercise, and environmental exposures such as air pollution. Um, we do know that once school starts, there's a good correlation where there's a sharp rise in asthma emergency room visits. Um, there's a study in a large metropolitan city that talked about almost a 46% increase in emergency room visits once the school year starts. Some of the other challenges can include missing maintenance and controller therapies due to having a little bit more rigorous schedule. Lives are a little bit busier. Some doses may be missed, and adherence may go down. Additionally, while at school, some children may not have that readily access to the rescue therapies when they're symptomatic, either due to school policy, a lack of an asthma action plan, or just that stigma that you mentioned about the bullying. Lastly, there can be some inconsistent communication, under recognition of symptoms that then can lead children to having increased asthma symptoms and resulting in their asthma flares. Age definitely plays a role in how we kind of educate as well as tailor kind of our therapies to really address the children's needs. Starting off at the young children, the preschool, elementary school age children, often these children can't really express or articulate their symptoms and really rely on their teachers, the school nurses to really recognize some of their symptoms. Additionally, some of these children are just starting therapies and medications and may not be used to having someone other than their parents giving medications when they're symptomatic. As for the middle schoolers, this is when we start to kind of give them independence in taking their asthma management under their control. However, some of these children may start to feel embarrassed using their inhalers in front of their peers. That can lead to undertreatment of their symptoms. As a result, that their asthma symptoms can fall behind and increase, resulting in emergency room or escalated medical care needs. Lastly, in our adolescents, this is where most of the parents are trying to encourage full independence of their asthma management. They oftentimes underreport symptoms, as well as really feel like that their controller therapies may not be necessary. They may not even feel like, hey, why do I need to take this if I'm feeling great every single day? That then can lead to an over-reliance on the short-acting beta agonist, because that really kind of would relieve their symptoms most. As a result, they miss doses and can easily have asthma flares.